Hello, my name is Dr. Joe Childs. I'm a board-certified functional neurologist, and today I want to talk to you about peripheral neuropathy. I want to go over our peripheral neuropathy recovery workshop. I want to talk to you about how peripheral neuropathy can be helped with functional medicine and functional neurology. Now, if you have peripheral neuropathy, if you have the tingling, the burning, the poor balance, the achy feet, if you're having these types of problems, you've probably been told by your medical doctor or your neurologist, you've probably been to multiple doctors, and they probably have told you there's nothing you can do about it, and that you're just going to have to learn to live with it. If that sounds like you, I'd like you to know that that is not the case. We help people with peripheral neuropathy every single day in our office, and we've been helping people with peripheral neuropathy for the last 10 to 15 years. So today this workshop or this video is going to be very eye-opening for you. We're going to discuss, again, the functional medicine and functional neurological approach to helping people, the drug-free approach to helping people recover and improve their peripheral neuropathy symptoms. So let's talk a little bit about me before we get going with the peripheral neuropathy. I'm a board-certified chiropractic neurologist. I'm trained in functional neurology. Now, most people understand what a chiropractor is and what a chiropractor does. Chiropractic neurology is a little bit different. Just like in medicine, you can become a specialist in orthopedics, you can become a specialist in, you name it, cardiology, you can become a specialist in a number of things. In chiropractic, you can specialize in a couple things. You can specialize in neurology, orthopedics, and things like that. So I chose to specialize in neurology, and it's an additional 3.5 years of education beyond the usual 8 years of chiropractic education. So that's what I do, and basically what functional neurology is it's drugless neurology. It's helping people with neurological symptoms without drugs and surgery. I'm also fellowship trained in minor traumatic brain injury and concussion. So we do see a lot of concussion cases. I'm trained in vestibular rehabilitation. Vestibular rehabilitation is helping people with dizziness and vertigo and balance disorders. I do also help a lot of children with neurodevelopmental disorders. I'm trained in functional nutrition and blood chemistry. I'm trained in helping people with spinal disc problems, herniated disc, degenerative disc, stenosis. So I'm trained in spinal decompression and biomechanics. And before I even became a chiropractor, I have a degree in exercise physiology from Penn State. So that's a little bit about me. Let's talk a little bit about what you're going to learn today. So what is peripheral neuropathy? We're going to discuss what that is. What causes it? What can be done to restore your peripheral nerves to health? And the key word is to restore them to health. We're going to talk about that as we go. So number one is neuropathy is very common. It's a chronic disease that affects 20 million Americans. It's when the electrical wiring, your nervous system, when the electrical nerves in your body are breaking down. Your nerves are not very much different than an electrical wire. This is an electrical wire, and electrical wires are covered with insulation, just like your nerves are covered with insulation. They're covered with myelin. It's called myelin sheath, okay? And then inside a nerve, you've got all these different fibers, and these different fibers do different things. One may transmit vibration sense, one may transmit movement, and things of that nature. So basically, in neuropathy, the electrical wiring in your body is breaking down. So your feet and your hands cannot communicate to the brain, and the brain can't communicate back down to your feet and to your hands. So what does peripheral neuropathy mean? Peripheral means further out from the body. So peripheral nerves are in the arms and in the legs. They're anything that's not in the central nervous system, which is the brain and spinal cord. So further out or distant from the body, so peripheral means away. Neuro means nerves and pathy means disease. So it's disease of the peripheral nerves. What are the 10 signs of peripheral neuropathy? Numbness. Numbness happens when the nerves are breaking down. Burning in your feet, cramping, sharp electrical pain, pain when you walk, difficulty sleeping from leg discomfort, prickling or tingling feelings in your feet, loss of balance and falling, weakness. Okay, the reason why you lose balance is because if you can't feel your feet, you're going to have a hard time with balance. Weakness and swelling, things of that nature. If you're suffering from one of these things, then there's a very high likelihood that you have peripheral neuropathy. So the symptoms are going to depend upon which portion of the nerve that is affected. There's different portions in this nerve. Some are sensory. Sensory nerves are nerves that carry sensation. So you can get numbness, you can get tingling, you can get burning, you can get pain. And then those that control muscles are the motor part of the nerve. The motor part of the nerve controls movement, so you can get weakness and things like that. And then there's also information that goes out to blood vessels. These are autonomic. So people with peripheral neuropathy may have problems with their blood pressure. They may have digestive issues. They may have orthostatic hypotension. They may stand up and get dizzy. They may have constipation. They may have urinary incontinence, sexual dysfunction. Because these nerves not only control your arms and things of that nature, they also control all your insides. Okay? Excuse me one sec there. Okay. So let's talk a little bit about the sensation changes. You can get nerve pain, tingling, numbness, and inability to determine where you are in space or joint positions, like where you are, where your feet are. This is going to cause balance problems. If you can't feel your feet, see, at all times I'm falling. When a person is standing, they're falling constantly. But if I go to fall to the right, there's more pressure on my foot on the right. That goes up to my brain, and my brain changes the position. I'm falling to the left or falling whatever. It's constantly happening, but you don't see me fall because it's happening so quick. So falls are the leading cause of death in patients or people over age 65. So making sure that you can feel your feet is absolutely critical to prevent you from the biggest cause of death in this country for people over age 65. For many neuropathies, sensation changes often begin in the feet and they progress. It's like a glove and stocking. They start in the feet because it's furthest from the brain, and they progress toward the center of the body. Okay? Then you've got movement difficulty. Motor fibers. Each nerve has got, remember we said sensory fibers, motor fibers. As this starts to degenerate, what happens is you start to have inability to have coordinated movements. You have inability to have strength in muscles. It can cause weakness, loss of muscle bulks, loss of dexterity, and sometimes cramps are a sign that your motor nerves are being affected with neuropathy. So how are we different? Okay, well, our approach is to rebuild and restore your peripheral nerves and improve your nerve and brain function using proven nutritional protocols as well as specific nerve stimulations and therapies. So we want to stimulate and we want to restore your degenerative nerves, and we want to get them functioning better again. The medical approach, or using neuropathy medications, or really, there really is no medications for neuropathy. They're really anti-seizure drugs that they use off-label for neuropathy. But medications are used to cover up the neuropathy symptoms at the level of the brain. So they don't affect the peripheral nerves, they affect the brain. That your nerves are progressively being damaged. They're not intended to reverse the damage. So the neuropathy medications, this is why your medical doctor will tell you, oh, you got to learn to live with it, it's only going to get worse, take this medication, because the medications are not out to actually fix anything. Okay? So these are anti-seizure medications. You've heard of them, Neurontin, Lyrica, gabapentin. They affect the brain, not the nerves. So they're not affecting the peripheral nerves. They have a lot of symptoms too. Here's some side effects of gabapentin. Drowsiness, dry mouth, headache, unsteadiness. It can reduce coordination or slow your reaction time, constipation, diarrhea, peripheral edema, dizziness, nausea, vomiting. I mean, these are things that these drugs can, because they're actually made for anti-seizure. They actually slow down the way the brain is firing. So let's talk about this a little bit. If you have a nerve that has neuropathy, it's going to send abnormal messages up the leg, all the way up the spinal cord, up to the brain, up to the brain. Where these drugs work is they work on the brain. They don't affect the peripheral nerves. They're not changing the peripheral nerves. So if you have pain signals, numbness signals, all this coming up to your brain, the anti-seizure drug, which is used to slow down electrical activity of the brain, slows down the way your brain is firing and functioning so that you don't feel the pain and symptoms. But the problem is still occurring in your feet and in your hands. It's not fixing the problem. So that's a problem. And I don't know if you understand that. What's going to happen is you're going to get worse and worse and worse. The other problem with Neurontin and Lyrica is they're highly toxic to new brain synapses. Because they shut down the way your brain is functioning and firing, they actually slow down the building up of new brain synapses. So that's not good for a person's brain that's, a 60 or 70-year-old person that's trying to keep their brain as healthy and functioning as well as possible to prevent things like dementia and different things like that. If you're taking a drug that's slowing down how your brain is functioning and how it's developing new synapses, that's a big problem. So these medications, may be necessary if somebody's in severe pain, but they're not really fixing the cause of the problem. Now here's the thing, all your chronic health conditions, whether it's neuropathy, whether it's digestive complaints, whether it's MS, any of these different types of things, they all have some common threads. So neuropathy, thyroid conditions, insulin resistance, diabetes, fibromyalgia, vertigo, sciatic, all these things, irritable bowel syndrome, they all have problems with metabolic imbalances. Anemia, chronic inflammation. We'll talk what inflammation means. Inflammation means there's swelling, it's inflamed, it's like a fire going on in your body. Unstable blood sugar issues. Adrenal glands, which are the glands that sit on top of your kidneys that secrete cortisol and control blood sugar regulation, they can be off. Hormonal imbalance. Autoimmune attacks, which means that your own immune system is attacking your body. These are called autoimmune attacks. That's one of the biggest things that idiopathic, or they can't figure out why you have the neuropathy. Most likely it's autoimmune. Gut infections, food sensitivities, low oxygen, and then neurological imbalances, the decreased firing in the brain and nervous system. So all these illnesses are a combination of neurologic and metabolic problems. So neuropathy is a neurologic and metabolic problem. And they require proper neurologic and metabolic treatment to help somebody. So your metabolism, the food that you eat, let's talk about metabolic here. The food that you eat turns into energy. 80% of our energy goes to what system in the body? Does it go to the endocrine, the digestive, the nervous, the immune, or cardiovascular? 80% of your energy goes to the nervous system, the brain and spinal nerves. Okay? We need proper metabolism and energy for your nerves to function well, for you to have good health in your nervous system. So some of the leading causes of neuropathies, what are some of the hidden reasons that you're having the burning in the feet, the neuropathy? What are they? Well, statin drugs. Everybody's on a statin drug these days because cholesterol is the enemy. We're going to talk a little bit about that, but let me just go into this. This insulation that's on top of these nerves, what is this insulation made of? Does anybody know? This covering, this is made of cholesterol. It's called myelin, okay? And what myelin does is it covers the nerves. It's made of cholesterol. So if you're lowering your cholesterol down the ridiculously lower levels, what's going to happen is that's going to make the nerves more prone to demyelinating, and that's what causes neuropathy. You can have a damaged back, causing herniated discs, arthritis. The nerves that come off of the lower back, these nerves, they come off of the lower back, and they make up the nerves down into your legs. So if you have damaged joints in your lower back, you are going to be prone to having compressed nerves, which makes you prone to having neuropathy. Chronic inflammation due to food sensitivities, inflammatory foods, hidden infections, diabetes or insulin resistance, and chemotherapy. Chemotherapy can also cause you to have neuropathy. If you have one of these causes, we can do something to address it. Let's talk a little bit about statin drugs. Like I said, statin drugs inhibit the formation of cholesterol. Cholesterol makes up the sheath that we just talked about, the sheath on the nerve. Statin drugs also inhibit the formation of coenzyme Q10. Coenzyme Q10 is necessary for nerve function. So statin drugs are a big cause of, one of the leading causes of neuropathy, why we're seeing so much of it. Study from the Journal of Neurology in May 2002 says that statin cholesterol drugs increase the risk of neuropathy by 16 times, 1,600%. Is cholesterol really the enemy? That's the question. Why has heart disease gone up? Just so you know, everybody's got this lower cholesterol now from the cholesterol medication, but what's happened to their to heart disease? Heart disease hasn't dropped at all. We have just as many people dying of heart attacks as we had before. So why do countries with chronically high cholesterol have lower heart disease? The problem is inflammation, okay? Why do just as many people with low cholesterol die from heart attacks as people with high cholesterol? That's because the problem is cholesterol will never clog your arteries unless you're inflamed. You need cholesterol for proper nerve and brain function as well as hormone synthesis. So we have people that get their cholesterol so low with these statin drugs. The lowest your cholesterol should go is 150. I have some people that come in with neuropathy, their cholesterol is 75. They're not making hormones. Now they're not making hormones. Hormones are essential to make testosterone. So now you got these guys that are taking gabapentin, they're taking statin drugs, they're taking hormone replacements, and hormone replacement increases their risk of cancer. So again, cholesterol is not the enemy for you, and if you've got unbelievably low, drug-induced low cholesterol, that's going to be a problem. The other thing is damaged lower back. That can contribute to neuropathy. Stenosis, which is narrowing of the spinal cord from degenerative and bulging disc and degenerative arthritis, have one thing in common. They create nerve compression. If you have nerve compression at the spinal level, and you combine that with low cholesterol, and you combine that with inflammation, and you combine that with high blood sugars, you're going to have neuropathy. So when these nerves get compressed, the nerve hole gets smaller and smaller, and it damages that nerve. So if you have compression in through here, the nerves of your lower back make up the nerves that go down into your leg. So your lower spine, if it's compressed, is going to cause problems as well. These are degenerative discs. The disc should be nice and open and healthy. This is a herniated disc which bulges into where the nerve exits out. This nerve exits right off of here, right? Comes right out of here. So if you have a bulging or a degenerative disc, it's going to compress that nerve at that level. So we need to deal with nerve compression to help somebody with neuropathy. This is a MRI of a disc of a lower back. So this is the lower back here. We're looking at the disc in through here. This is a bulging disc which is putting pressure on the nerves that eventually come out and go down into the leg and feet. So herniated and bulging discs are not always there with people with neuropathy, but it's very common to see it. So we use a therapy called decompression therapy, which slowly takes pressure off of those nerves and heals up the discs in the lower back. It's extremely comfortable. Patients love it. The majority of people fall asleep on it. That's one of the therapies that we do if you have a compressive version of neuropathy. Then we've got diabetes and insulin resistance. So nerves need energy to survive. When your blood sugar is high, what occurs is it swells the nerve, which compresses on the blood vessel that's going to the nerve, so it cuts down on the oxygen supply to the nerve. Diabetic neuropathy is a big problem. In this country, we eat way too much carbohydrates, way too much sugar, and if you combine diabetic neuropathy, inflammation, nerve root compression, you're going to have neuropathy. If you just take gabapentin to shut down your brain, or you take Lyrica to shut down your brain, you're not getting at the cause. And what's going to happen is it's going to get worse and worse and worse, and eventually your balance is going to be bad and you're going to be at fall risk. Chronic inflammation. Inflammation is swelling in the body, or it's like a fire going on in your body, right? So if you have a fire going on inside your body, it's going to damage certain structures. It tends to damage nerves and brain tissue more than anything. So one of the biggest problems with people with neuropathy is they're chronically inflamed. So we need to find out, are you inflamed? We have to look at nerve inflammation markers. So what are some common causes of inflammation that contribute to peripheral neuropathy? Food sensitivities, inflammatory foods. We want to replace that with a diet called a paleo diet, which is an anti-inflammatory diet. Hidden gut infections. You can have parasites in your gut. We can test for that. You can have dysbiosis, or not really good healthy bacteria, which makes your gut inflamed. If your gut is inflamed, your brain will be inflamed, and your nerves will be inflamed. Poor omega-3 to omega-6 fatty acid ratios. Everybody tends to eat way too many omega-6s, which are inflammatory. Omega-3s come from salmon, come from fish, flaxseed oil, things of that nature. High insulin. People that have diabetic neuropathy or type 2 diabetes or insulin resistance have high insulin because their receptors in their cells are really bad, and they have hormone imbalances. So we want to check for all these things to find out if you have inflammatory neuropathy. Metabolic causes need to be addressed if you are going to win the battle against peripheral neuropathy. We're going to do blood testing to find out what's going on. We're going to do a CBC, a chem panel. We're going to check you for iron and ferritin levels. We'll do a full thyroid panel. We're going to check for inflammation markers. We'll look at your lipids to see if your lipids are where they should be. They shouldn't be over 200, but they shouldn't be under 150. Okay? We're going to test for food sensitivities. Inflammation markers are things like C-reactive protein, homocysteine, things of that nature, uric acid. If those things are high, it means your body's inflamed. So have you had these tests? Now, I always hear this all the time. People will come in and say, "Doctor, I've already had the test. My doctor's looking at it. He already told me that everything is normal." And the reason why things seem to be normal is because these are lab ranges. So when you go to get some blood work, the lab ranges that you see from either Quest or LabCorp or wherever you have it, the reference range of where you should be, it always comes in where this is where you are, this is your test range, or your test value, or your result, and then there's the range of where it should be. Those ranges that you're looking at are laboratory ranges. That is the average of everybody getting blood work. So what that is all the people that get blood work over a period of time, they make it the average, and that's how they come up with the ranges. So if you look at the people that are giving blood work, most of the time healthy people are not going for blood work. So you don't want to be the average of the unhealthy. We use something called functional lab values, which are more sensitive and reveal problems. The functional range is the average of all the healthy people without any disease, without any problems and health challenges. So this is why your lab tests are normal. So you may say, "Oh, my blood sugars are fine, they're 105. Well, blood sugars shouldn't be over 100. Or my blood sugars are fine, they're 60. That's hypoglycemia. So you've got these, this is the functional lab ranges. This is where you want to be. For example, again, glucose should be 85 to 100. If you come in at 110, this is the typical range that they're going to say is normal. Okay, so cholesterol should be 150 to 200. But if you are below 150, they're going to say that's normal. You see what I'm saying? So we're going to look at these functional ranges. Then we do some special testing because we know that if the gut is breaking down, your GI tract is breaking down, then you're going to be inflamed. So we're going to run a couple special tests usually. We'll run something called an intestinal antigenic permeability screen, which is a leaky gut test. Because if you have a leaky gut, what will happen, and this is what a leaky gut looks like, what your digestive tract does is your digestive tract provides a separation from the external environment and the internal environment. So when you eat food, that food's really not inside you when it's in your digestive tract. It's inside you once it gets absorbed into your bloodstream. So there's a barrier, which is your gut barrier, which provides a separation between your bloodstream and your inside of your GI tract. There are cells inside your gut that have what's called tight junctions. And the only thing that can get through the tight junction is fully digestive food. And if that's the only thing that gets through, then that provides nutrition for your body. But if you have a leaky gut, and this is a microscopic thing. So I had a patient one time say, "Doc, I had a colonoscopy, they didn't see a leaky gut." A leaky gut is microscopic, so you can't see it. So a leaky, this is a microscope, so we can see what it looks like, okay? You can't see it with the naked eye. So it should be tight junctions, like that's tight junctions, this is a open junction. So what happens is now undigested food, bacteria, parasites can get into your bloodstream and can create inflammation. If you get these big cells coming through, like let's say it's a steak you ate, or let's say it's a piece of wheat that you ate, or some wheat. That wheat needs to be broken down into the protein called gluten, which needs to be broken down into peptides and amino acids. The only thing that should fit through are amino acids. But if there's a leaky gut, what will happen is larger peptides will come through, and your immune system will react to those peptides and create an inflammatory cascade. So we can do a blood test called a leaky gut test, which will let us know if you have that happening. If you have an inflamed gut, then you can have an inflamed brain and peripheral nervous system. We can test to see what kind of foods you're sensitive to. A lot of people are very sensitive to foods, and when you're sensitive to foods, it can be the cause of the leaky gut. In fact, there's research. If you Google this, you can look at neuropathy. This is a paper. Neuropathy is associated with gluten sensitivity. So some people have gluten sensitivity, which causes them leaky gut, and then eventually the gluten gets through and creates an inflammatory cascade. This is don't take my word for it. This is a paper on gluten sensitivity and neuropathy, and it is from the Journal of Neurosurgery and Psychology. So it's not from some out in left field journal. So that's important to understand. So we wanted to do these special tests to find out, do you have food sensitivities, do you have gut breakdown? And so when you can't feel your feet, what happens to your brain? So as you start to lose feeling in your feet, you start to have really bad balance. And because the information from your feet and from your body come up to your brain and keep your brain healthy, okay? So if you cut a nerve, you're going to change your brain. They did a study. They said if you cut a nerve, let's say you cut the nerves from your arm. They've done this on animals. You know, as sad as it is, they do these studies. They cut it. They cut the limb, the nerve from a limb. That part of the brain will get smaller. So if you start to have death to your peripheral nerves, these guys start to die off. That's eventually going to affect your brain. It's going to cause poor balance, memory loss, depression, anxiety. If you combine that with low cholesterol, high inflammation, it's going to make you more prone to Alzheimer's and things of that nature. So your peripheral nervous system will eventually affect your brain. And don't take my word for it. This is Peripheral Neuropathy, Differential Diagnosis and Management, talking about that exactly. There's this map in your brain. Okay, it's called the Soma Map. And so what happens is different parts control different parts. And you can see that here's your foot, so you can start to lose, and your hand, you can really start to lose function in those areas of the brain if you have deficiency in the information firing up from the neuropathy. So neuropathy greatly reduces your balance. The people that have long-standing neuropathy, the person that has just the numbness and tingling in the feet and the pain in the feet, eventually become the senior with the walker. And the reason why I go over that is because statistics show that falls are the leading cause, the #1 cause in death from injury among people age 65 and older. So if you can't feel your feet and your brain is not functioning well because you have neuropathy, there's a good chance that you're going to fall. And that's why we test balance and things of that nature. We do a CAPS balance test, which will let us know what are your limits of stability. How big of a risk of falling are you? So we've run this test on people to find out, you know, are you going to fall anytime soon? You know, it's a true statistic that falls are a big cause of death, and neuropathy is a #1 cause of falls. So the biggest thing that we want to do is we want to restore your nervous system, restore your peripheral nerves, and get them functioning better. There's a term called neuroplasticity. Neuroplasticity means that if you stimulate a nerve and you provide it with nutrition, that it can actually rewire and actually regenerate. Something that's essential. So you remember I told you, your medical doctor probably told you that there's no way you can get better, you just got to take these drugs and you're just going to have to learn to live with it. Absolutely not true. If we stimulate the nerves and make sure that the environment is in good shape, you can improve. So what does a neuron need? What do your nerves need to revive and repair? Well, we need fuel, good glucose levels, 85 to 99, proper oxygen, so we use oxygen in the office for patients, and no inflammation. So we want to get that to happen. We do that with our metabolic care, and they also need to have activation. We need to activate the nerves in your feet to get them to work again. And we got to take the pressure off them at the lower back level as well, or the neck level if it's your hands. So we do something called rebuilder therapy. Rebuilder therapy stimulates the peripheral nerves. You put your feet in this bath, and there's a stimulation, electrical stimulation, that will stimulate the nerves electrically, block pain, and improve blood flow. It stimulates the nerve biochemically and allows for greater metabolism in the nerves. It's going to reduce inflammation locally. So we want to stimulate the nerves with rebuilder therapy. What else do we use? We use laser therapy. Laser therapy increases, we put cold laser therapy on your feet, and what that does is it increases blood flow and circulation, and it creates angiogenesis, which is the creation of more blood vessels and better systematic or anastomosis of blood vessels. So it increases the sprouting of blood vessels to increase oxygenation at that area. So it helps regenerate the nerves. So we do that in rebuilder therapy. It's called class 4 laser therapy. It's a specific wavelength of light that's been proven to go into nerve cells and help them repair. So what else do we do for nerve activation? We do rebuilder therapy, we do low-level laser therapy, we do vibration on the nerves to activate the nerves, oxygen therapy, we do chiropractic care, we do vibration to stimulate the large diameter nerves. The large diameter nerves are the ones that send messages for vibration, touch, position sense. We want to get those working. Those are the ones that die off. The question is, why do you have pain when you have pain nerves? Because when you have neuropathy, why do you have pain? Because again, we have all these different nerves, and the large diameter nerves are the ones that die off first in neuropathy, leaving. So when they all die off, normally they're very fast. They're called large diameter, so they're super fast. They get up to the spinal cord faster than the pain nerves, and they block pain nerves. But if these ones die off the quickest, the reason why the large diameter, vibration sense, position sense, balance nerves, all those types of nerves, the reason why they die off first is because they require the most amount of fuel. So then what will happen eventually is all you have is pain nerves. And so now if you don't have the vibratory nerves, you don't have the large diameter nerves, now pain gets amplified. So that's why you get amplification of pain when you have neuropathy. And then eventually these pain nerves and motor nerves, they all start dying off, and then you have nothing. And if you have nothing, this is when you need a walker or you need something like that. So you shouldn't get to that point. There are things you can do to prevent that. We do oxygen. We want to give the nerve oxygen, so we put a cannula on, so all of the exercises and therapies and things that you do in our office to improve your feed and your nerves are going to be done while you're on 95% oxygen. Very good for your brain, very good for your nervous system. So in summary, we're going to do a comprehensive blood work. We're going to look at the functional ranges. We're going to look for any metabolic conditions, inflammation, blood sugar issues. We're going to put you on an anti-inflammatory diet. And then we're going to improve neuropathy. We're going to create healing in the nerves by taking, first, number one, we've got to take pressure off the nerves. We do that with spinal decompression therapy. We do rebuilder therapy to stimulate the nerves. We do laser therapy to stimulate the nerves and improve blood flow. We do vibration therapy. We do chiropractic care. And then we do customized nutritional supplementation and diet to help the peripheral nerves. We get outstanding results. So in review, our approach is to rebuild and restore your peripheral nerves. The medications you're currently doing shut down your brain so you don't feel the damage occurring and the damage continues to occur. So the question is how bad are you? So in our initial exam, we're going to do something called the Toronto Peripheral Neuropathy Grading System. And it's going to include a complete neurological exam and a grading system determining, we're going to test each and every one of these fibers in your nerves to find out how much sensation you have. We're not going to do any EMGs or needle testing or anything like that, EMG or NCVs. So we're going to test sensations. A normal score for our peripheral neuropathy Toronto testing is a 74. So we're going to find out, are you a 20 out of 74, a 10 out of 74, a 50 out of 74, and that's going to let us know how bad your neuropathy is and what exactly you need. When somebody gets down to 0, it's going to be very hard to fix that person. So hopefully we'll catch you before you get down that low.
All right, I'm here with Mary, a patient in our office. How are you today, Mary?
I'm doing great, thank you.
Good. What were some of your concerns prior to coming in?
Well, I was having a big problem with neuropathy in both of my feet, especially the left going up to mid-calf, and I had prior problems with sciatica on both sides, but mainly the neuropathy, and we saw an ad in the paper asking if you had burning and tingling in your legs or feet, and that's what attracted us to come in and see what this was all about.
Wonderful. And how long were you dealing with the symptoms of neuropathy?
It was more than 2 years, and I didn't like taking Lyrica for the pain.
So what did the neuropathy affect the most in your life?
Probably balance and not being able to do some of the activities I like to do, shopping and walking, not feeling secure going up and down steps.
Okay. Well, since having care with Dr. Childs and Dr. Durr, what has improved?
Oh, the neuropathy, quite a bit. I don't have any of it. I'm not taking Lyrica anymore. Now that I'm off the Lyrica, I've lost weight, my memory's improved, and nutrition-wise, the diet that I was following, I've lost weight without any effort, and I'm also walking taller, my posture's better. I just feel so much better.
That's wonderful. How is that all impacting your life?
You know, I'm just able to do more. I can accept more invitations to go places. I have a lot more energy. I'm just really pleased that I came to the practice.
Wonderful. Any other thoughts on Dr. Childs or Dr. Durr or the office?
Well, both of them, the doctors are very well educated. They're very friendly, they're polite, they're respectful. And then the whole office itself, everyone is really easy to get along with. They all get along with each other. It's almost like you're around family when you come in here. And I highly recommend it. I think people should take a look at it, and then you'll feel better.
Thank you so much.
You're welcome.
Hi, we're here with Dawn Toros. Hi, Dawn.
Hi, how are you?
Good. Well, I'm going to ask you, what health complaints did you have prior to coming to the office?
Well, I had nerve pain in my feet for about 2 years, and I went to many different doctors, podiatrists, specialists, and they couldn't figure out why I was having nerve pain. And then I started doing some research online on my own, and I came across Dr. Childs and Dr. Durr's website, and I started reading more about autoimmune disease. So luckily they were close by, so I decided to give them a try, and it ended up that I had a lot of autoimmune disorders going on. So I was finally able to get an answer to why I was having foot pain for so long, and which was such a relief.
Wow. Well, what did it affect most in your life?
Well, I used to be extremely active, going to the gym 5 times a week, and always taking my dog out, and it just affected everything. My sleep, I was depressed, couldn't work out like I used to be able to, and it was just, it affected work. There was many days when it was just hard to walk around.
Yeah. Well, since having care with Dr. Childs and Dr. Durr, what has improved?
Well, I would say everything. My feet have improved like 60%,
Wonderful.
and I'm sleeping better, eating, the diet has helped a lot. I feel better, and I'm less tired, and which is leading to less stress and less depression.
And that was an impact on your life.
Yeah.
Wow. Any other thoughts on your experience at the office?
No, I think it's been great. It's a big time commitment, but everyone here makes it easier, and everyone's friendly and cares about you personally, and it really cares about you getting better, and which is really nice, because a lot of doctors just don't get to know you personally, and everyone here in the office is great.
Wow. Thank you so much, Dawn.
Sure.
All righty.
Alright, my name's Jamie, and I'm here with Alex Gojkovic, a patient in our neuropathy program. How are you, Alex?
I'm doing well, thank you.
Good, great. So what health complaints did you have prior to coming in our office?
Well, neuropathy was being a great problem in my life, affecting my sleep and my ability to go places without being tied to the med. It really was a problem that continued to get worse.
Alright. And how long was that bothering and affecting your
For a
life?
couple of years, not knowing what the problem was, but that was another story. But when I found out what it was, I went online and tried to Google a problem, or actually a solution to the problem, and Dr. Childs and Dr. Durr's name came up, and gave him a call.
Awesome. Alright. So what did the neuropathy affect the most in your life?
Again, sleep and the ability to go places. It just seemed that if I didn't have the meds with me, I couldn't go through the day. I couldn't make it through without taking them at the prescribed times, and it was a real hassle. If you leave the house and not have it with you, you had to turn around and go back and get them.
Alright. So since having care with Dr. Childs and Dr. Durr, what has improved?
Since my sensitivity to my feet, I'm able to feel things. I don't have the pain or the burning sensation as much. It's more tolerable, and able to sleep better. And again, I don't take the meds that's prescribed anymore. I'm down. I can go through the day without taking them, and it's really helped out. And I feel a lot better, and with getting better sleep, and able to go places without worrying about did I bring them with me.
Great. So how is that impacting your life?
Impacting my life greatly. Like I said, I feel a lot better. I'm able to go places and do things without worrying about did I take them or do I have them with me or whatever. And just all around, my feet feel tremendously better. I'm glad I came here.
Excellent. So any other thoughts on your experience at the office, on the doctors or the staff?
Doctors and staff are great people and really friendly people and open, and they're very knowledgeable. They seem to know what they're doing here, and I trust them wholeheartedly. And I would recommend them to anyone who has this problem to give them a call and go in and see what they can do for them.
All right, thank you so much, Alex.
Thank you.
Hi, Wayne. How are you doing today?
I'm doing really pretty good. Mm-hmm.
Good. Now, what health complaints did you have prior to coming to the office?
Well, the main complaint I had was that my feet, particularly my left foot, was sometimes numb, and I had a lot of pain in my feet, especially if I'd been on my feet very much. And it was there most of the time and got worse when I was on my feet a lot.
Okay. And how long did you have this?
Oh, for many months. Probably over, especially the coldness, which I didn't mention, but probably for a few years. It had been getting worse and it concerned me.
Okay. And what did your peripheral neuropathy affect the most in your life?
Well, it bothered my sleeping, and it was just a pain that was there all the time and made me kind of weary. And I couldn't work really as effectively as I'd like to, or enjoy life the way I'd like to.
Right. Since having care with Dr. Childs and Dr. Durr, what has improved?
Well, actually, the pain and tingling and coldness of the feet have improved a lot. It's not gone, especially in my left foot. But it has improved a lot, and many nights I don't even have any problems at all. I don't have any pain or discomfort in the feet, and so that's been really a big thing. And I can do yard work and other activities for several hours without having major discomfort. I may have minor discomfort, but it's much better.
Great. And how is that impacting your life now?
Well, I would say that I can go about my business without that kind of nagging pain and discomfort, and I can do things without being concerned about suffering quite a lot later. It really has improved a lot.
Great.
Yeah.
And any other thoughts on your experience at the office with the doctors, the staff, anything you'd like to comment on?
Well, you all are wonderful people, and so I'm very thankful to have come here, and also thankful for what you've done for my wife. And you just have a great system and a great practice here. So thank you very, very much.
All right. Well, thank you, Wayne.
Okay.
Good morning.
Good morning. My name is Al Grantz.
Well, good morning, Al. What health complaints did you have prior to coming to our office?
Well, I've had idiopathic peripheral neuropathy for 10 years, along with rheumatoid and osteoarthritis. They're my biggest complaints.
Okay, well, how long did you suffer with those?
Since about the year 2000. 10
Wow.
or 11 years, yes.
How did that affect you in your life?
Well, it affected everything. The worst part was that the medicine I was on, methotrexate for my rheumatoid arthritis, was a very powerful medicine. It was developed as a cancer medicine for women, but for about 25 years they've used it for rheumatoid arthritis, and it worked very well on me. The problem was that every time I had a blood test, which was monthly, my red blood cells were very suppressed. And I asked my doctor, my primary care physician, how long I'd have to stay on this, and he said forever if you don't want any pain. So I asked my rheumatologist the same question, and he said the same thing, forever. Well, it's always concerned me, and I heard Dr. Durr and Dr. Childs talk about, having some kind of a remedy. And I come in and I talk to them, and what they said was that my autoimmune system was attacking itself, which is causing these autoimmune diseases, rheumatoid arthritis basically, and neuropathy. And I'd never heard that theory before, So I signed up.
Well, since having care with Dr. Childs and Dr. Durr, what's changed?
Well, I've been here about 4.5 months. First thing I went off was furosemide, which is a water pill, and potassium, which you have to take when you're on that water pill. Then 4 weeks ago, I went off my methotrexate. Now my rheumatologist had told me I could never get off this for more than a couple of days without the pain coming right back. I've been off for 4 weeks, and that's not a long time, but I don't have any pain. I also took my neuropathy problem. I was taking Neurontin for that, and that's a 600 milligram pills every 8 hours, 24/7. So I was taking 1,800 milligrams a day. I cut that down at the same time to 600 milligrams. I just take 2 pills before I go to sleep at night. And I plan to soon cut that in half and see how I can do without, that. Now I'm still on a pain pill, Dolac, which eventually in the next few weeks I'm going to try and get off that. So it's great to be off these pills, and I'm anxious to see my next blood test, which I will get November 1st, to see whether, my red blood cells are still suppressed.
So how's all this impacting your life, Al?
Tremendously. First of all, my wife, couldn't believe it, that I take an array of pills, and I have to, when we travel and so forth, I've got to take these pills with us, make sure I'm taking them at the right time and so forth. And all of a sudden, I've cut down 2, 5, 7, 9, 11 pills. I mean, my daily deal here. So it's affected me tremendously that way.
Wow. Do you have any other thoughts on your experience in the office, the doctors, and the staff?
Well, I just think the doctors are fantastic. I have to say this. I was extremely skeptical. It sounds great, but they said if they can just get my autoimmune system not attacking itself, things should improve. Well, damned if it hasn't. I mean, I'm nonplussed. I mean, well, I just couldn't believe it. I mean, talking to my primary care physician, talking to my rheumatologist, I'll never get off these pills. And I was really concerned about that. My primary care physician said, you'll have to take these, forever. I don't like that. I mean, I don't think anybody likes to take pills, but boy, I tell you, I am just so happy. I think Dr. Durr and Dr. Childs are eminently qualified. They're tremendous doctors, and the whole staff is extremely well qualified. Everybody knows what they're doing, how they're doing it, when they're doing it. Things just roll in here, and boy, it's a busy office. I've never seen a chiropractor's office this busy. But I can understand why, and I'll tell you, I'm living proof. I just like to shout it from the rooftops. If you've got rheumatoid arthritis or osteoarthritis or neuropathy, as I have had for 10 years, and you want to get rid of it, come talk to these people. You got to do it.
Well, thank you very much, Al.
You're welcome.
Hi, Doug. How are you today?
Good morning. I'm doing fine, thank you.
Okay. So, Doug, can you tell me about what health complaints you had prior to coming to the office?
Basically, my right foot was very numb most of the time, and a lot of pain, and when I would go out anywhere, I would hobble around, and I would not be able to walk any distance. Like when I went to the museum with my family, I had to stop and rest and slow everything down for a while.
Okay. So how else did it affect your life?
The just basically created fatigue and discomfort.
Yeah. I'm assuming it interfered in your time, your happiness.
Oh, absolutely.
And how about sleep?
Sleep could become difficult. Trying to, it was very difficult, especially if I tried to put a blanket over my foot. I had to kind of stick my foot out so it was no pressure on it.
Right. Now, since having care with Dr. Childs and Dr. Durr, what's improved?
The improvement has been very dramatic. now when I go somewhere, I can stay on my feet, I can walk around and do normal activities. We've been back to the museum and been able to spend the whole day roaming around and looking at all the good things. And when I go out for a walk, I don't have to stop every 100 yards or so to take a rest.
And how's that impacting your life?
Oh, very, very dramatically. Able to maintain and do things I'd like to do.
Right. Doug, do you have any other thoughts about your experience at the office, the doctors, and the staff?
Yes, very impressed with corrective chiropractor, Dr. Childs and Dr. Durr. Equipment seems to be very advanced, and I know that they work on their training and go to improve themselves, as well as conduct the workshops. And in fact, that's how I got started up with them this time, coming to the Peripheral Neuropathy seminar. Yeah.
Excellent. Well, thank you, Doug, for your kind thoughts.
Well, thank you.